I'll say it's a great morning here in South Carolina, isn't it? Thank you much. Thank you much. This is historic. You know, it's been declared Telehealth Awareness Week, and I think it's one of the first times any state has done this formally. So this is really great for us in South Carolina. What it gives us an opportunity to do is really highlight all of the good things that are going through the Telehealth Alliance, which you're going to hear a lot more about as we go through. This will be a short press conference, but the good thing for you is we've got a lot of experts here who are going to be able to answer your questions specifically about what we're doing in telehealth in South Carolina. I'm going to read a governor's proclamation in a moment, but we have a state senator here who has been one of the champions, one of the biggest supporters of all of our telehealth efforts in South Carolina, and I'd like for Senator Thomas Alexander to make a few comments.
Well, good morning. It's a pleasure to be here today for this press conference and this focus on telehealth here in South Carolina. To Director McGill, we appreciate your leadership. You know, it's really the telepsych has really not only for South Carolina but nationally been recognized, and it's under your leadership. We appreciate that, and now that we've expanded to other aspects of telehealth. You know, telehealth is, I think, the wave of the future. Provides access to care, access to providers that is very critical, especially in South Carolina. Being from the mountains, from Oconee County and a rural area of South Carolina, we understand the importance of having telehealth throughout the state of South Carolina. I think it's also worth noting today of the partnerships and those that this Telehealth Alliance has brought together. And I think that is a great statement about the people of South Carolina, the professionals that are behind us here, the partners out in the communities. That's really what makes South Carolina so special, is that when there is a common goal, and it's to improve not only the access, but the outcomes to better health for the citizens of this state. We are united. And that's the reason I'm proud to stand with you today. Have the opportunity, and I think it's good for us to put this focus in this press conference, and appreciate the governor's proclamation about this, because it is about the future of South Carolina. It's about the future of health care, and for us to be on the cutting edge and being a leader in that regard. And I look forward to great strides being done in the future, that we have the opportunity to be successful, to build upon the model, to bring the partners together, to understand the challenges that are out there. It's never an easy process, that when you're starting something, an initiative new, but it takes willing individuals, willing to sit down and roll up their sleeves and work together to find outcomes that will serve the people of the state. So that's the reason I wanted to step away for a few minutes from the work of the Finance Committee and come over and be with you for just a few minutes. I apologize, I won't be able to stay for the whole thing, but I do believe in the Telehealth Alliance in South Carolina, the work that's being done, the work's being done, and the future of this program that would be looked at and say that we were on the cutting edge and from the foundation. So thank you very much for y'all being here and being a part of this alliance. Thank you.
Well, you know, I'm just a proud partner of the Alliance. I'm the director of the South Carolina Department of Mental Health, but I must tell you, being able to have some of my work blended with the fine work that's being done, headquartered at MUSC, but as you'll see all over the state with all of our hub sites, it's truly revolutionary for a state to take on the task that we've taken on and rather quickly move South Carolina to close to the top of the heap in all states doing telehealth. You name it, if it's clinical delivery to health services, why we're doing it in telehealth, and we're going to do more and more of it so that we can take it statewide and, as they say, raise all boats, get the services that are needed to those areas of the state, particularly the rural areas that need a lot of the help. And I think Chairman Smith is with us, so Merle Smith, if you don't mind coming up and saying a few words.
Thank you. Thank you, Director McGill, and I appreciate everyone having me here today. And I just want to tell you how pleased I am to be a part of this proclamation and be here today. This idea was started about 4 or 5 years ago, and as you know, we didn't have a whole lot with telehealth in South Carolina. In 4 or 5 years, the state has made an investment with the support of many people who are standing behind me, and we're now providing access to the rural areas of the state. And that's one way that we are improving and innovating health in South Carolina, is by partnering with entities that bring access to care. It's important to those of us who are from the rural areas to be able to have this access to care. So I want to thank all the partners that are here today. Thank you for your interest, for your involvement, and most importantly for what you have accomplished in improving health care in South Carolina. So thank you very much.
You know, it probably goes without saying, but the General Assembly is very important to maintaining what we do in telehealth and continue it. And Senator and Mr. Chairman, thank you very much for your help, and please continue supporting all the efforts in telehealth we have. Now, it's my pleasure to read the proclamation that our governor has issued commemorating Telehealth Week. So if you'll bear with me, I'm going to read this to you. Whereas telehealth is the use of electronic information and technologies, including video conferencing, the internet, store and forward imaging, streaming media, and terrestrial and wireless communications to support long-distance clinical health care, education for patients, as well as professionals, public health, and health administration. And whereas focusing on coordinated patient-centered health care, telehealth provides increased access to medical specialists with consultations typically occurring more conveniently in the office of a primary care provider, whereas in addition to remote clinical health care, telehealth provides patient learning, continuing medical education, provider training, and administrative meetings, and whereas telehealth services in the Palmetto State include hospital ICU, acute stroke, pediatric emergency and critical care, general neurology and infectious disease care, community medical homes with maternal fetal medicine, pre- and post-surgery consultation, psychiatry, sickle cell and nutrition counseling, and innovative portals to care as home monitoring and consultation, school-based care, and special location for victims of crime. Now, therefore, I, Henry McMaster, Governor of the great state of South Carolina, do hereby proclaim March 24th, 2017 as South Carolina Telehealth Awareness Week throughout the state, and encourage all South Carolinians to learn more about telehealth and its valuable contributions to better health care and an improved quality of life for the people in the Palmetto State, and that means all people if we can. Thank you very much. Now, you know, a lot of us here, those who are at MUSC and then all of the hub and then me at Mental Health, we could talk on, and because there are a lot of wonderful things we have to say, but you know, what really sells is when you hear from the people who've been the beneficiaries of some of the telehealth services. So we have a couple individuals here today who said they would be willing to talk a little bit about their experience, and they're just going to take a couple minutes to tell you what that experience was like. And the first one is Michael Andrews. Michael?
Thanks, sir. Yeah. How you doing? For me, the main thing was perspective and how much time it was going to take. I'm a father of 6 kids, so my time is very limited, and I work in the IT field, and being on call limits that time even further. My first choice was actually to go to Walmart. I got there at 7:46, and they offered to schedule me the next day. That quite wasn't good enough for the way that I was feeling at the time, so I thought I'd give the telehealth application a shot. I had heard about it at work, so thought I'd give it a shot. And I found that downloading the app and being able to talk to a doctor directly surprised me. It allowed me to focus on, the screen and the doctor focusing on me. One of the other items that I was really surprised about is after the doctor's visit was over, the prescriptions that he had sent over to the Walmart clinic, I got a summary of the doctor's visit, of what I spoke about, what he spoke about, even some of the homeopathic recipes that he suggested that I try. All of that was put into a PDF and emailed to my email address. And I found that very useful because it allowed me to be able to follow up with my primary care doctor with documentation of what was stated, what was prescribed. And I'm not real good about, remembering exact chemical or prescription names of items, nor am I very good about remembering the exact verbiage that a doctor may have used at that particular time. One of the other items I do want to state is that being in this information technology environment, being able to have all aspects of that visit put into my electronic medical record was a real boon. So for me, in the future, it is an opportunity that, or an avenue that I'll use because of its convenience, because of the level of care that I've received. And I have to state, in deference to the doctors behind me, I'm not a real fan of waiting in waiting rooms with other sick people. So it kind of, alleviated that concern as well. But I appreciate you giving me the time to share that with you, and thank you.
Melissa Allman wanted to share a few words with you. So Melissa, would you come up?
Hi, good morning. My name is Melissa Almond, and I am actually a 20-year employee of Palmetto Health and a very thankful patient. I actually had the opportunity to use the smart exam system that's offered by Palmetto Health on 2 occasions. Once on a Saturday night when I was busy with my 2 boys who are ages 3 and 8, and we were at home, and I just have one of those very long-standing colds. It just wouldn't go away. So by Saturday night I said, I'm going to have to make a doctor's appointment on Monday morning. But then I remembered that we had smart exam. Maybe I could just use a smart exam system to see if I really needed to look for any further health care. So the entire process took me about 2 hours. I was able to log into the system, to create an account, and to have my information sent to a clinical professional to review to see if I needed to seek further care. They were able to give me my information back and to send me a diagnosis, and also, just as the gentleman before me, some things that I could try. Turned out that it was only viral. Cold and flu season, as you can imagine, in October in South Carolina is not very fun, especially when you have 2 small kids at home. But then on another occasion, I was able to use it during my lunch break at work. I was able to go ahead and log into the system again. This time it was much shorter because I already had an account created. And instead of having to make an appointment, drive to the doctor, pay a copay, wait in the waiting room, I got to do all of this on my lunch break while I was, at work. And I got to continue on to my day and go home to my family, and I wasn't exposed to anybody else who was sick. So I really think that this telehealth is just probably one of the greatest innovations that we've got so far as improving the care delivery for just the general public. So I think that all in all, for South Carolina, this is great. I'm so excited that we are on the cutting edge, and I think that it really just makes a difference for people who are busy, who lead really busy lives, who have small kids at home, who don't have a lot of time to take away from what they do every day, to actually seek care and get care from an actual clinical professional. Thank you.
Well, we have a special treat for you now. There are a couple individuals who agreed to come and talk with us today, and they've benefited from some of the school telehealth project. If I get your name wrong, Elney, I got it. How about Burgess and her son, Tristan Stuckey, are here to share with you. Okay?
Good morning. Oh, this one? You can turn this one into.
That will come off.
Okay. Good morning. Just take this off. Okay, let's do it. Yeah, there we go, buddy. All right.
Telehealth makes me feel better when I am sick. It doesn't take a long time like when I have to go to the doctor's office or the emergency room. It also makes me stay in school so I won't have to make up any work. Telehealth is a good system that students all over the world should use.
All right. Does it sound good?
As a parent of a student that receives telehealth, knowing my child can get good quality health care without missing school, which in turn can cause him to get behind in class, is a plus. And of course, not to mention less time that I have to take off from work to take him to the doctor's office or to the emergency room. And what I love the most is, of course, is there's no wait time like in a doctor's office or a busy emergency room. He's seen fast and efficiently. Prescriptions are called in. When I get off from work, all I have to do is just go to the drive-through, pick up the medication, and we're done. The doctor can call me if she has any concerns, and I'm at work and he's still at school. So telehealth is definitely going to be a part of our future. Thank you.
Very good, Jim.
How about another hand for them, if you don't mind? That is something. You know, any statewide alliance needs partners, good partners, and some of the partners who are represented here today, who are behind me, actually were the key people beginning the alliance themselves. And they do represent some of the larger health systems in South Carolina, because that was very necessary to get the alliance off the ground and get it going. So they have become, in many instances, some of the hubs of where a lot of the activity occurs. And they're here with us today, and I'm just going to tell you the organization they're with, but then I'm going to encourage you to ask questions, because they're doing exciting stuff all over the state. And if you'll ask questions, good questions, hopefully real hard questions of all of you, I will take the mic and give it to them and let them answer some of those questions. So, to wit, we actually have representatives from systems in Columbia, Palmetto Health, correct? Greenville Health System, McLeod, and what's that? Charleston. All right. So, what we have here then are some of the experts in the field who are doing very, very innovative things all over the state. We have the leadership from MUSC that is managing the Telehealth Alliance resource. Some of you from the media have handouts, I believe, with some of the information. Adrian, is that correct? So, let's have at it. Any questions? Yes, ma'am. Would you mind identifying yourself?
Oh yeah, I'm Marina. I'm from ETV, South Carolina Patient TV, and I wanted to learn a little bit more about the critical care pediatric program from MUSC.
All right, the pediatric program from MUSC. Going to take it?
Thank you. Yeah, I'm Dave McSwain. I'm one of the pediatric intensivists at MUSC. And several years ago, we started a program in pediatric critical care to provide consultations to rural emergency departments around the state, particularly in the low country area. And through this program, we're able to provide emergency coverage of community hospitals that otherwise would not have access to pediatric subspecialty services in a really critical situation that's extremely time sensitive. So the program has been very successful. Right now we're in 4 hospitals in the low country, and we've actually also been working very closely with partners from other hospitals in South Carolina and the other children's hospitals to expand that program. And one of the great things about South Carolina is the degree of collaboration that we've had across the state. And I think that the pediatric program and the South Carolina Children's Hospital Collaborative is a great example of that collaboration.
Other questions? Oh, incidentally, you know, a system like this couldn't really perform without assistance from a lot of other agencies. And I do want to point out somebody, Palmetto Care Connections, Kathy Swalding is here. Kathy, you've made a big difference in everything you do. Kathy is also co-chair of the advisory group that with it. So, additional questions? Then I've got some. Oh, you have another one?
So how do you guys identify the hospitals and clinics that need these services?
Okay, who wants to take a shot at that? Jimmy? how we identify hospitals that need the service. Thank you.
Well, all of them. I'm just joking. But no, we do try to follow needs assessments that we do each year. We do try to follow a strategic plan that we collaboratively put together each year. And we try to match the low-hanging fruit with the services that are available. But programs such as the mental health program and the telestroke program, they really are pretty widely needed across the state, especially if you're not in a major urban area in the state. So there's plenty of demand for service. It's been about creating enough capacity to provide the service, getting the finances right so the service is sustainable going forward, and then beginning to develop new services and new telehealth modalities. So trying to look at what do the hospitals need. I think going forward we'll be looking closer at what the critical access hospitals, those smallest, most in need hospitals in our state, and we'll continue to look forward to making a match between services that are developed that meet the need. So it should take constant attention to assessing needs and responding with service development.
Now, Dr. McGill, he is the guiding force behind the project at MUSC and directs a large staff that attempts to do. You know what I would be interested in doing? I wonder if a representative from each of the hubs would come up and talk a little bit about what you're doing at the hub. Who wants to come up first? All right, Dr. Marissa.
I represent the University of South Carolina and Palmetto Health, which is the hub. And we've been very fortunate to be a part of this initiative, which clearly has allowed us to collectively come together to be able to work across state agencies, academia, healthcare institutions in the areas, as Mr. McGill mentioned, infectious disease, mental health. I think mental health was a pioneer starting in 2009. So this is the Department of Mental Health, the University of South Carolina, as well as the South Carolina Hospital Association. And we've been able to demonstrate we have not just gone on to improve access to care, but also we have made care more affordable, be delivered at the doorstep of our patients. We've also been able to show on cost savings for the state. So it's not just about improving access while addressing shortage of providers that we have in our state, but also in trying to make a business case. And to me, it's truly important for us to look at various stakeholders. How do we involve payers in the mix? And I think the Telehealth Alliance has been very strategic in involving various stakeholders, including consumers, as you heard some of the patients speak up here. And I think that to me is key. Alone we can do little, together we can do much. Thank you very much.
Thank you. Who wants to come up?
Hi, I'm Carly Howard. I'm from the Greenville Health System. I'm a general pediatrician, so I'm better spoken on the pediatric programs. We do have a really well-developed telestroke and telepsychiatric program at Greenville. But we also have, I think, a more unique program to our state called Delivery Buddy in Greenville, which is actually where we can connect our neonatal nurse practitioners and neonatologists at our regional perinatal center to our outlying smaller community hospitals where they're delivering infants. As you know, many times the complications for delivery are unexpected, and so within minutes we can have an expert on the line to assist those providers. And one thing to just point out is that it's not replacing anything. We still have the same neonatal trained providers at those hospitals that we've always had, but it's just augmenting the care that they were already providing with that subspecialty expertise.
One more.
Hey, my name is Brian Frost. I'm from Florence, South Carolina, McLeod. I'm a practicing emergency physician. I'm board certified in emergency medicine, still practice. I also serve as the Chief Medical Information Officer for McLeod Health. And this is exciting to me as an end user. So I think about the evolution of healthcare, not only in our state, but also in our country, the way we deliver healthcare, the way we receive it. And I think of it from an end user perspective. I think of it as a consumer, which really is what our patients are. Healthcare to this point has been very healthcare centered, so the patient's centered around the provider. And what's exciting about this is this puts healthcare where the consumer, the customer, the patient wants it. It's on their terms. Our patients are busy people who have families, who have jobs, and it's sometimes very inconvenient, but also impossible to access healthcare in our current environment. So what makes this extremely exciting for me as a provider, thinking about those providers who provide emergency medicine, urgent care to people, that's why we do this. We love patients. We want to help them. We want to care for them, and we want to meet them where they are. So we want to make healthcare accessible to all patients, and we're really the beneficiaries of this as consumers, as patients. So thank you.
We have one more member of the General Assembly who would like to share a few moments with you, Representative Harrison from Dorchester County.
Hi, good morning, everybody. My name is Katie Arrington. I'm the representative for Dorchester and Charleston counties. I have to say that what I do in my day job, aside from being a legislator, has everything to do with telehealth. The Department of Defense uses telehealth every single day. It saves lives. In the state of South Carolina, how that funnels down is that if we're able to give people the opportunity, and our job as a legislator is to make it so that it's as accessible to everyone as possible, but it drives down the cost of healthcare insurance and it gives people the immediate access to a doctor. Telehealth will change our nation. We need to have this in the state of South Carolina. We need it for everything from the senior communities, where if you have an active over 55 community that has a telehealth pod in the community area, how much more are we going to be in an ability to be proactive and extend the life and the quality of life from somebody if they can see a doctor in a telehealth environment? All the way down to the people in Department of Corrections and being able to lower the cost for transport for people that are in Department of Corrections behind the bars, fences, sorry. But we're able to give them the care that they need, but reduce the cost of the taxpayer in transportation and security. So telehealth is the absolute wave of the future. You're talking to somebody who lives it, breathes it, and thinks about it every day. And I applaud the members of the medical community and the IT community of making this happen. So thank you all.
I think you get a sense of the excitement that all of us feel about not only what's going on in telehealth, but the future is unlimited with what you can do with telehealth. Some of the brightest mental health, public health, surgeons, any side of medicine you want, some of the brightest people have really hooked on to telehealth. And you see many of them standing right behind me. So I hope you'll join us. Hope you'll have the enthusiasm we do for telehealth in South Carolina. And I just say, remember, the future of our citizens' health, a lot of factors will influence, but the ability to get services through telehealth is going to be one of the most important things that is going to occur in this state in the future. Thank you very much.